Health officials in Montreal expressing some relief these days as monkeypox cases in the city numbers appear to be stabilizing. The city has been the epicenter for monkeypox since the outbreak began in North America, but concerns are growing now in other parts of the country. And Michael Serapio has the details for the latest in Canada. Good morning, Michael.
Good morning, Heather. And you're right, there is growing concern for the number of cases we're seeing from coast to coast. We know from the latest federal update, officials in this country have now identified 681 cases of monkeypox, with the vast majority of cases in Ontario and Quebec. But the numbers are going up across the country. Cases are popping up in BC, Alberta, and Saskatchewan specifically. And really, that's the backdrop to an interesting proposal that we're right now tracking from Ontario Member of Provincial Parliament, New Democrat Kristen Tam-Wong. She is calling on the provincial government to introduce a permanent program to allow workers to take 10 sick days for any infectious disease and 14 additional sick days during public health emergencies. Now, currently Ontario offers 3 paid sick leave, but that is only for COVID-related absences, not about monkeypox. And those days are meant to be used things for like testing for COVID, caring for family who may be sick, and isolating. But this idea from Kristen Tam-Wong would apply again to all infectious diseases and public health emergencies, noting that without giving these days, officials would not be doing all they could to prevent further spread of the disease. And in the case of monkeypox, we know that those who contract it can be sick for 21 days, if not longer. Take a listen to Ontario MPP Kristen Tam-Wong.
Don't know who has it because it has such a long incubation period, is that we have to be extra careful. Right now, ERs as well as hospitals are on the verge of collapse.
And you'll recall that over the weekend, the Director General for the World Health Organization declared monkeypox a global health emergency, which means he believes the disease is a significant enough threat now to merit a coordinated international response. Ontario's Labour Minister, in response to Tam-Wong's proposal, says they are monitoring the situation, but have not yet made any decisions on preventing any further paid sick days, Heather.
So, Michael, seems the situation is getting a bit better then in parts of the country?
They are, specifically, as you noted right off top, in Quebec, and health officials in Montreal specifically, which, as you also said, is the epicenter of the Quebec and North American outbreak. Well, they say the number of cases seem to be plateauing in the province, but they still have a couple of concerns here. One, the numbers are now soaring in the United States, and with the busy tourist season happening and underway in Quebec, they fear as tourists come, the numbers could go up once again in the province. And in addition to that, vaccination rates remain low, with between only about a third to a half of those eligible getting a vaccine so far. Take a listen to virologist Benoit Barbeau, who is from the Université de Québec à Montréal.
One of the concerns is that if you leave it to spread around the population, there might be a possibility that it could actually start jumping to other animal species, and therefore these animals could become reservoirs, and as reservoirs could actually maintain the virus despite our effort to control it.
So there does remain concerns, Heather, despite improving numbers in Quebec, and that has public health officials still very busy. We are at this point going to be monitoring another update. This will come from the Public Health Agency of Canada. They'll tell us about the latest monkeypox picture. That will be around 1 p.m. Eastern out of Ottawa.
Yes, so let's look at those times. 9:30 for the WHO this morning, Michael, 1 o'clock for the Government of Canada update. Much more to come on monkeypox today, obviously. Michael, thank you very much.
You're welcome.